This episode is brought to you by Young Innovations. Are you ready to transform your career as a dental hygienist? Join us for an eye-opening webinar that I am providing in partnership with Young Innovations on December 3rd at 7 p.m. Eastern Standard Time about redefining the role of the dental hygienist, unleashing leadership potential and advancing your career. This is your chance to discover untapped opportunities and take your profession to new heights. Whether you are looking to step into new leadership roles, expand your clinical expertise, or explore new paths in hygiene, this webinar is designed to help you thrive. Don't miss this opportunity to invest in your future. Register now on the Young Dental website at youngdental.com under education. Thanks, Young, for supporting our show and championing dental hygienist professional growth. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner. Today, I have an innovator with me, Marvelyn Navarro. You are an amazing hygienist, and I cannot wait for you to share your story. Welcome so much to our show.
Thank you so much for having me, Dr. Tanner. It's a privilege to be here with you. I'm so excited.
You were just in Utah with some of my besties over there, and what an amazing group they are, right?
They are who I'm their hashtag goals. I told them that from the platform. We were up there and I said, we need to get everyone involved in the association just like they are. There was like 500. It was amazing.
Yeah, they are a force there and just so positive and uplifting. So I know that you're busy traveling and speaking and being an entrepreneur, but I always ask with the question, why hygiene for you? Like, why dental hygiene? Did you choose it? Did it choose you?
I think I always knew I wanted to be in healthcare. And I was debating between being a nurse or a hygienist. I had family in the dental field already, so they were pushing me to be that. So I did shadowing. I actually went to a local hospital here in town and said, would you all let me volunteer? And they said yes. And I think that nurse really gave me the hands-on experience. And as someone that hadn't even completed their prereqs, was doing a lot of stuff in there. And I think I got a little scared. And I was like, whoa, this is a lot. So then I decided that I wanted to work from here up after that.
Yeah.
I decided to go into hygiene.
Choose your section, right? So
and
did you...
smiles. So I've always loved teeth. I gravitated to them. And I always say your smile is the prettiest thing you can wear. So I definitely love that about our profession.
It is. We empower so many people with the health of their smile. And now, as we know, their overall health. So you practiced hygiene for a while. Tell us about that, where you practiced and what did you do after that?
So before I became a hygienist, I actually got my foot in the door and I worked at the front desk. So I was doing front desk, billing, insurance, receptionist, doing all of that. And I was able to also observe the hygienists and what they did. And it was so amazing because hygienists wear so many hats. Not only are they there performing oral health and improving the oral health of patients, but also improving their overall health and their lives. And I loved that. And I loved that it was just intimate with them. And they even became like their therapist and their best friend, right?
Yeah.
And so I decided to, while I was working there, I pursued my journey as a hygienist. I was doing my prereqs, going to school, and I actually graduated and went back to that same office. So I was at that office for about 14 years.
Wow.
And 8 as a dental hygienist.
That's crazy. So you went from front office to hygienist. Do you feel like that helped prepare you for hygiene school?
I did. I think it's a good eye opener of what you're getting into. And you can also observe what the front does as well as the back. And when you do become a hygienist, then you are more familiar with the codes that are using to be built out. So I do feel like it was pretty well-rounded experience having that front desk experience as well.
Yeah, there are so many times when I'm working with teams and I'm in offices and the front is saying about the back, they don't know what we do. And the back is saying, they don't know what we do. And it's nice to have that experience for both where you can bring it in. And I think it offers a strength to the office wherever you end up practicing. And I know too that for some offices, they require cross training and all of those, being assistant, being front office, not being the dentist because we can't do that work, but and being the majority of the other clinical and non-clinical roles. So everybody knows what everybody else is doing.
I do agree.
Yeah.
Yep.
So then you went from clinical hygienist, and then now tell the world what you're doing. It's amazing.
So I also wanted to get my feet wet with a little bit of everything. And I remember Young Innovations had this posting for a clinical educator. And I honestly didn't even meet all the qualifications, but I went ahead and applied. I went through a round of interviews. They liked me, they hired me. So then I became a clinical educator and representative for Young Innovations, and now a KOL for them for almost 4 years. And so I do a lot of trainings, onboarding for offices, and also speaking on a nationwide platform in regards to innovative dental technology. So speaking also has become one of my passions. And I just love connecting with colleagues such as yourself and just helping uplift all of us and helping us get to the next level. And I think when we are in unison, that is something we can all achieve.
So you said something. You said, I applied for a job I don't even think that I was qualified for. What was going through your head when you made application for that? Like when you couldn't check yes to everything?
I was like, hey, I don't qualify for everything, but that doesn't mean no, right? My husband and I always joke and we say, shoot your shot, right? You may miss some, but you also may
Yeah.
hit some. So
Yeah.
that is the approach I decided to take with that. And I shot my shot and I was able to actually become part of the team, which was really awesome. And I have gained so much experience even doing that, going office to office, building relationships with
Yeah.
doctors, hygienists, front desk. So I do feel you also see a different side of dentistry in that aspect as well.
Yeah. So you went from clinical to corporate.
Yes.
Okay, which is a whole different thing, right? And now you're an entrepreneur and a KOL. So you have had I can't wait for you to tell everybody the next thing. So tell us how you're an entrepreneur and what you're doing.
So I am specialized and trained in what's called dental endoscopy, and it is a fiber optic camera that you can put subgingivally in essence, and then it's illuminated onto a screen at 100 times magnification, where we can treat periodontal gum disease in a minimally invasive way. So therefore, you can actually see where the calculus is, remove it thoroughly, and give the patient a better chance at combating that periodontal gum disease. Because we know that there's two etiologic factors to periodontal gum disease, right? One is that dysbiotic bacteria, and two is calculus. So if we're not removing all the calculus, that bacteria will continuously grow. Therefore, you have this periodontal wound that is not healing. So I say, let's fight periodontal disease face on, where we can see where this
You can
calculus
see
is.
it.
Yes, and remove it thoroughly. So being trained and specialized in that for now almost 7 years,
Mm.
I did have an amazing mentor while she was here in Las Vegas. Unfortunately, she passed away after COVID. Um, but she trained me on this technology, and she did something similar. She was going around to a few offices and she had her own endoscope unit. So I was so passionate about this. I was treating all my patients with an endoscope in the GP office, and I said, what more can I do with this? I feel there's so much perio out there. We know statistics from the AAP, and we can do so much more. And knowing a lot of hygienists such as myself, type A, we need to be challenged, right? We need the new exciting
Yeah.
best thing. I was like, what can I do? So I took her model and along with my business partner, Katie, and we just made it so much better. And now we are out partnering with multiple offices in our town of Las Vegas and treating their periodontal gum disease patients in-house with our own endoscope machine that we bring.
So you go to other offices.
I do. So in essence, we are the traveling specialty dental hygienist.
I mean, how is that not cool? That is so cool. So they make an appointment with you on the app, or how does that work? How do they get you to their practice?
So we go in and build a relationship with their office. We let them know what to look for, what kind of cases would be able to be treated with this dental endoscope. And then we keep in constant communication. So whenever they have a patient, they call or text us, we give them dates, and then that is when we come in and bring our unit and treat their patients.
That's so cool. And then you and your partner, you guys both live in the same area. So it gives you that flexibility when you're surging too, when you have multiple offices.
Yes. So when we do have multiple offices, we definitely coordinate with one another and we make it happen. Well, you'll take this part of the week, or even if one of us on vacation, we still have each other, right? So it's amazing because we can just take it, and we've done it all around town. So Las Vegas, Henderson, there's so many little towns just here in Las Vegas, and we have partnered with so many dentists.
So what's required to know how to utilize this technology? I'm sure people have to have some training. Do we have access to purchase the device as a hygienist, or does a dentist have to do it? And what are all the formalities of that?
So a hygienist can purchase their own unit. It's not against the rules, right? You just and with the purchase of the unit, you also get trained. So I know there's two companies that do sell it right now. One, there's been rumors that they're going to stop the manufacturing of it. Their company's Zest. So there's a newer company, they're Perio, and they actually, when you purchase the unit, they actually include the training with the purchase. So it makes it so much easier. But what's required and what we would recommend so you become proficient is in that 2-day training, you have live patients. So you do need an office, and depending on your state, supervision of a dentist. And you would train on an early periodontal case, maybe stage 1, with 6mm pocketing, good amount of clicks. That way you can visualize and see them and actually remove. Mm-hmm. And then the second patient, maybe a little bit more involved, such as a stage 2 case, 7mm pockets, 8mm pockets. That way you get the good experience in a shallower pocket versus a deeper pocket. And it really takes, they say, about 100 quadrants for you to feel comfortable, because you're using 2 hands and 2 feet at the same time while using the endoscope, while looking at a machine. So think about it as playing a video game. You are 2 hands involved. You're not looking in the patient's mouth. You're completely looking at the screen.
Oh, wow.
With your dominant foot, you would use your cavitron or your piezo pedal. Non-dominant, you would control the fiber optic camera. It actually also flushes water, because we know when we're dealing with advanced perio, there's a lot of hemostasis present or bleeding. So it helps reduce the amount of hemo, and you get a greater visual on the screen. Mm-hmm. Your non-dominant hand, you would hold the camera or the Explorer, and then your dominant hand, of course, your piezo or your cavitron. So and looking at a screen. So it's like hygiene school all over again, right?
Wow. Yeah. That's a whole new skill set. Like, yeah. Really. And then what do you use for suction? How are you?
So we have our favorite. I'll say, I guess I can say hands, right? It's the relief suction.
Relief is good.
It's a hands-free, right? So we have the relief in there. It's on the high evacuation suction. And with the amount of water we have present, we definitely need that high evacuation suction. And it's comfortable for the patient.
It is.
So it makes our job easy as well as the procedure, and it's comfortable for the patient.
Yeah, I'm just thinking about the mechanics of it, like hygiene school, because my brain just went there. I'm like, okay, where's the suction? Where in this? And so how long does the procedure take for the patient? I guess it depends, right? On the number of sites and involved teeth.
Usually what we deal with is a full mouth case. So patients don't want to come back. They're getting this procedure done. We have patients that opt for half the mouth at a time, but the majority opt for, so honestly, it's about an hour per quad. So we're with the patient for a good 4 hours.
Okay. And then with this, as I understand it, it doesn't have its own code yet.
No.
Not yet.
Not yet.
Get Kathy Forbes on it, man. She'll get us the code. Kathy Forbes, get us a code.
Come on, Kathy.
Come on, Kathy, do us a solid. Shoot your shot on this. And so right now it's an unspecified periodontal procedure, correct?
Correct. It's that D4999 code that you can bill per quadrant in conjunction with the SRP code.
Okay. So You're treating everything like you normally would. You have vision that's magnified 100 times. You're going around to offices. You're handling all your scheduling, which
Yes,
is amazing. And now you're a business owner.
I am. Yes.
You're a business owner because you have not just this technology, you're managing relationships, you're managing a new schedule, you're training, you're speaking. How was that to go from clinical to corporate to business owner? What'd you learn?
I've learned so much, but honestly, as hygienists, I think we are a unique breed. We are so crafty, we are so organized, and it is possible. And I think with the experience from front of the house to clinical educator to hygienist has molded me into how we can thrive and build these relationships with our customers or clients or doctors. And you just learn how to communicate with these dentists, because mainly that's our main source with our business, but also just in general to clinicians and people and patients. So I think with all of the experience we have, it really sets you up for success. And if you organize yourself pretty well, you can achieve that. I always like to say this quote that if you have an action plan, if you don't have an action plan with a goal set in mind, it's like an unsharpened pencil. It has no point. So
Hmm.
you really need to get organized and set goals, even if it's 3 or 4 a month that you want to honestly achieve. Focus on those goals before you move on to the next one. Because we can write 100 things on a list of paper that we
Yeah.
want to master. But the reality, we cannot master all 100 in a few
Right.
days.
Right.
So if you just keep with a steady momentum, I think it's very doable, and we can do so much in our field with anything we choose to do.
Yes, we can. And I think too, knowing that even if it's imperfect, even if it feels like failure, if it doesn't go the way that you think that it should the first 2 times, the first 5 times, that through
Yes.
practicing and through perseverance, that while it may look a little bit messy or feel a little bit messy to us, that through that you're learning, right?
And I think that's something my business partner and I, Katie, we've kind of had to go over a hurdle. We wanted everything to be perfect, but we know that we will never reach that perfection if we keep with that mindset. So you have to actually implement what you have, trial and error,
Yep.
and just improve it. Nothing will ever be perfect. And I think that is the way to go.
Yet I think people appreciate that. They appreciate the human element to it. And I think when you think it's perfect is then when it changes, because then you get this bit of information that then makes it even more perfect in our mind. It just informs the process that you're using, and it makes us better because when I'm delivering a program, I know it takes me probably 20 times to feel like I'm an expert at it. I can talk about it in my sleep. I don't even need slides. It's like I can just talk about it like it's not there because I can see it in my head and all the points that I want to make. And I think with something like this too, that the more you do it, the more you're thinking of solutions and more those come to you more naturally because you have done it.
Exactly. And you can just keep making it better
Yeah.
as you learn. Keep improving your action plan or your goal or your method that you are using in your business.
hmm So, what were some surprising things that you learned when you became a business owner?
I would say the tax component, right there, that's a whole new beast in itself. Learning all the laws, the tax component, learning how to operate QuickBooks, and how to pay yourself as a business owner, because we are just W-2'd when you're usually in a practice, but now
Yep.
you're a business owner and there's a million ways to pay yourself depending on how you set yourself up. So
Yep.
just making sure that you're setting yourself up correctly so the tax and the IRS doesn't come after you.
Yeah, it's not just because there's money in the bank that you can use it.
Exactly. It does not work
It's
that
like,
way.
oh, it's in my checking account. Thank you. Thank you. It's this, and there's taxes for that, and structuring your business so it is more tax savvy so you can have those savings on that. So yeah, there's definitely, I just switched financial systems this past year to from one system to QuickBooks, and that was a learning curve. Just, and QuickBooks is intuitive, but it's all the little, oh, you have to click here to look for this. But
Exactly.
what I know to be true is that whatever it is that we put our mind to, we can absolutely do it. Because if you got through hygiene school or dental school, you can do this, right? It's just, we have to be patient with ourselves and give ourselves room to learn, not necessarily fail, but to learn, and for it to be imperfect, and not expect that it's going to be how we want it in a day.
Yes.
Right?
It's not going to happen overnight. No. Your clients don't come overnight. Coaching sessions don't come overnight. It takes a lot of grit, and you have to have a lot of patience, even with yourself and with your business. There's going to be great months, then there's going to be low months, but it's just keeping going and keeping your eyes on the prize on what you really want to attain or achieve with your business.
Yeah. And it's going to change too, because you may think that you are going to have a business a certain way, but then you realize when you're doing that, it's, oh, and I can do this, and I can do this, and look at this opportunity that's here. Now you can probably, I'm guessing, teach other hygienists how to utilize this technology and take this business model into their own community, right?
Exactly. And we do that. So we train fellow hygienists and we help coach and educate them on how to keep going. When we were trained many years ago, there was nothing like this. So we were trained by an out of state hygienist, one, and then I was so lucky to have my mentor. But that out of state hygienist came once, we never saw her again.
Mm.
It was just, we had to kind of put pieces of the puzzle together. And yes, we can communicate through text or phone calls, but I feel it's not the same. So we are really building a community. I heard there's less than 1% of hygienists in the whole nation that do this procedure. So we're hoping that there is more. We've created a Facebook group for support.
What's your Facebook group?
So it is the Dental Endoscope Network, I believe.
Oh, okay.
I'll have to get the exact name. But
Yeah.
we're inviting everyone to that. So we're sharing cases. We can bounce ideas off one another. And we're just making ourselves more available. We're out there speaking and educating on it. And that's our goal and our mission. We want to make sure that we can help everyone treat patients better than the standard of care, right? We want this to be the gold standard of care so we can treat periodontal disease and have vision.
Yeah. And see it literally and figuratively, right?
Yes.
It's such a cool thing to be able to have an idea and to take it into reality, isn't it?
It is.
And to see it operate. It's almost like birthing a child. It's almost like that in some ways, because you're proud of where you've come, and you can look back and say, this is where we started. You guys started it as a coffee visit, you were telling me, with a dental rep. And
Yeah.
then you guys had a mutual interest, and then there you were. You never know how meeting someone is a synchronicity in your life, because I think that everything is.
I 100% agree with that. And everything has just been at the right time, the right place, and it's just coming all together. And just yesterday, we finally got some merch for ourselves. We got some cute pens and some cute hats and totes. We're going up to Reno this weekend to the Nevada session, and we're giving everyone a great tote. But just seeing that come in the mail and seeing your company on a merch was so surreal. I got so teary-eyed, like, this is our baby. This is our business. So like you're saying, it's amazing, the feeling that comes with it. And then also success. When there is success, we have to celebrate our small wins, but also our big wins too.
Absolutely. Because I think that, and that is sage advice, because I think so many times we wait for the big thing or the big milestone of, okay, when we do this, then we can be happy. Or when we do this, then it'll be enough, or whatever. But you take those little wins throughout the day and say, you know what? I found a way to use this a little bit differently. A person asked that question, and man, I really got to think about things differently. And therefore we can do this, because I had a guest on yesterday who said he was a overnight success over 35 years. It took him 35 years to become an overnight success. I think that's what he said. Because it takes all that, but all of a sudden it seems to go click because this technology has been around for a while.
It has for over 20 years. But as we were talking about, technology is booming right now. And there's AI in dentistry now. There's digital x-rays. No, it's just booming. And I feel it's the perfect time and place. And we're over that curve where this can finally be the next level of care for us as hygienists. And if you want to challenge your career and take it to the next level, why not learn this new skill where you can treat your periodontal patients with subgingival superpowers? And instead of guessing, hey, did I get that off that CEJ or did I leave something behind? And then you take an x-ray. Ever since I got the endoscope, I'm like, wow, even if you take an x-ray, there's still something there.
Yeah.
Even if the x-ray looks smooth, we're looking at a 2-dimensional image and we're compared to a three-dimensional tooth. So it's surreal that you can have that ability.
And am I in the furcation? Is that cementum? Is that the overhang? Is that the restoration? What is that? I don't know. Is that you don't have to wonder anymore. You can see it.
Exactly. And I will say it was a very humbling experience because then when I started implementing it into the practice I was working at, I started retreating some of my scaling and root planing procedures. And I thought, right, like all of us, we strive for our best, type A. And I was like, I'm a great clinician. I did great. Then I got in there with my endoscope. I was like, oh, I missed this. But it's very humbling and it just makes you strive for better. You learn how to adapt your inserts in a different way. Sometimes I'm on a lingual and I'm coming in through my buccal because let me tell you, bacteria and calculus knows how to hide.
Yeah, it does.
And it's hard especially if we can't see it. So sometimes I have to get really creative with my left and rights. I'm even using it a whole different way just to even remove a piece of calculus.
Yeah, it's advanced instrumentation is what I call it in hygiene school.
Yes.
Like, welcome to your senior year. This is called advanced instrumentation, which means using this in a different way.
Yes. And that is another one of our goals. We're working with our alma mater here locally, and we're trying to implement endoscopy just to expose the students to it as well and to show them, right? Sometimes I remember being back in hygiene school, your instructor would come and mark you off. Nope, you missed here. And you get so frustrated. How does she know I really missed that? Right? And you're so frustrated because you've been working on that same distal line angle for 2 days now. And so this will be eye-opening even for them as an educational tool, just putting that endoscope in there and, oh, wow, it is still there. Or look, there was a lot more. It will just be humbling for them, but also push them to work harder.
Think about how this changes clinical boards.
I know.
This is disruptive.
Right.
It really is. Well, go ahead.
I was like, I think they have a good scenario, right? There's 3 of them and 2 at least have to agree in order for it to be marked off. So there's no bias, right? So that's good.
And then someone comes in with the endoscope and it's like, no, all y'all are wrong. Yeah. None of you guys felt what was there.
I know.
It's like,
Yeah, and I definitely want to say this, like, we're not on here to make any hygienist feel less than they are, right? Sometimes this just new technology that's out there to help us be better clinicians.
Yeah.
If you had some kind of surgical procedure you wanted, would you want to be cut up versus minimally invasive? I think all of us would want the minimally invasive approach. Likewise with our patients. So it's just a different approach, a different treatment plan, different treatment option for our patients.
Yeah. Yep. Absolutely. It is a diagnostic tool.
Yes.
Right. To help you be able to visualize and see, like a radiograph, like a 3D scan, like that. So you can help people see what they need to see to educate them and to help you give the best treatment plan and the best treatment outcomes and try to talk to your patient about where they can go from here. Right?
Yes.
Well, thank you so much for being on. It's been a pleasure having you on the show. And I'm so proud of what you're doing.
Thank you. I'm so proud of what you're doing as well. You're amazing. You have your podcast and you also have your own company. So that is amazing. You're definitely a great, innovative example as well.
Thank you. It takes all of us. And what I love about having guests on the show is that it gives you examples of how people are doing it, how it didn't seem conventional to them when they were first doing it, but they did it anyway. And now you have Marvelyn's contact information in the show notes. You can reach out to her for anything. She, I'm sure, is answering right away or within 24 hours on any questions you may have. So thank you guys for being here today. And thank you each for all that you do, touching lives. And, I always ask you to go on over to Apple Podcast and like it so other people know that you like it. And then go on over to YouTube, like, subscribe, and share. And thank you all. And we will see you soon. Take care.
Bye.